Well, warning tonight for you from a local doctor to call 911 if you think you or someone else is suffering from a stroke. That advice is especially important to follow if you live in rural areas of the tri-states. WGEM's Charity Bell tells us why.
Casey Kendall has worked in emergency medical services in rural areas of Pike and Adams counties for over 20 years.
Plenty of times where we've been called to stroke patients, they should have called much sooner. And as a result of that, there's usually not as good a prognosis and outcome for those patients that have waited.
Illini Community Hospital emergency room physician Dr. Darren Thomas says in rural areas like this, sometimes people rush themselves to the hospital thinking they can get there faster, but says that decision could make the situation worse.
You need to call 911 because the process then gets the trained personnel to your location as fast as possible.
He says when you call, EMS arrives to your door, begins administering support at your home, en route to the hospital, and alerts the hospital's stroke code so doctors are in place to treat you when you arrive.
And that supporting staff and system is not in place if you drive yourself to the hospital and just check in the front door.
Kendall says with strokes, like heart attacks, the quicker a person is assessed, the better the outcome.
The longer it takes to initiate the emergency response system, the longer it takes for you to arrive at the hospital, then you're going to have tissue loss at that point.
Charity Bell, WGEM News, Pittsfield, Illinois.